couple of pictures of the colon showing you different things that can be found. This here is actually a normal, nice, cleaned out, healthy looking colon. This, on the other hand, is a cancerous polyp. And you can see it has a nice stalk. And essentially what they've done, you can see this apparatus here is biopsy forceps. They have lassoed this, and you can see how the stalk is turning white right here. They're actually trying to burn it and remove this polyp and send it to the lab to see what's going on. There are a lot of good YouTube videos that you guys might consider watching for both upper and lower endoscopy procedures. Just showing you a couple of pictures of ulcerative colitis. And so here you can see the patient has various ulcerations throughout the colon. And here what's happened is they have actually taken a biopsy. A couple of pictures of what is found on an EGD. Remember, an EGD is an upper endoscopy. This patient has extensive gastritis. This is the scope, okay? And the scope is actually looking back on itself, and you can see that the patient has a lot of inflammation of the gastric lining. This is also the scope. Scope is looking back on itself, and you can see this pocket right here, and that pocket should not be here. And so this is what a hiatal hernia looks like. Okay, the last test that we're going to talk about, the first one is ERCP. We're on page 881. An ERCP is an endoscopic retrograde cholangiopancreatography, so we'll call it ERCP. It is essentially just like an EGD. The scope is a little bit longer, so the procedure is just like that for an EGD. You actually, though, go down through the stomach, flip into the duodenum, and gain access to the bile ducts. And from there, with a special instrument that you pass through the scope, you can actually inject contrast medium and be able to visualize the common bile duct and the pancreatic duct. Really what you're looking for here, mainly gallstones, and if they find them, they can actually retrieve them. Also looking for any narrowings, and if there are narrowings, there's an instrument they can use to open them up a little bit, and if you also need to do a biopsy. Post-op is pretty much like an EGD. They come back to the floor, they've had sedation, monitor vital signs, and make sure that the gag reflex is returned before you give them anything to eat or drink. Flipping the page, just a couple of special studies. Amylase and lipase would actually help you to diagnose pancreatitis. Liver biopsies. Liver biopsies are done down in invasive radiology. What happens is the patient has a biopsy of the liver with what's called a spring-loaded biopsy forceps, and the physician inserts the needle somewhere between this about 6th to 9th intercostal space on the right side, guided by fluoroscopy so they can see what they're doing and get a piece of liver tissue. This can be done for different reasons: the diagnosis of hepatitis, the diagnosis of liver failure, a tumor. Pre-procedure, it's really important that we make sure that the patient's clotting studies are within normal. Typically, they will type in cross, MPO. The patient will not be given sedation. Usually, it is a quick procedure, and the patient has to be cooperative in that they have to take a deep breath and hold it. After the procedure, the patient has to be monitored for bleeding, so we have to take vital signs and look for changes in vital signs. Typically, they do like to keep them for a couple of hours and have them turned up on their right side, keeping kind of a pressure on the puncture site, and then make sure the patient knows that after they leave, they need to be aware of signs that they're bleeding. And last, stool samples. You can obviously do check stool for many different things: white blood cells, heme positive, certain types of bacteria, such as we can identify C. diff in the stool, and so you just have to do a stool collection. that is the end of GI assessment. Make sure that you guys review GI anatomy and physiology on your own, and make sure that you do a good review of medical terminology for the GI system.